Don, how is reimbursement changing in the U.S.?
Well, reimbursement is changing based on what used to be more is better to now managing within a fixed payment scheme. So we need to understand all of the behaviors we had and all the things that were medically justified in the past may not be justified for payment in the future. That's going to drive different incentives for people as they move forward.
What are the challenges your customers see with regard to coping with these challenges, John?
Well, the changes have a rather broad effect on the organization. So in addition to new information technologies that have capabilities such as workflow engines and analytics that they must bring on board and install and implement well, there's also relationships that they have with the medical staff out in the community that become different. There are processes within the organization that have to change to make sure that they thrive well. There's an understanding of different kinds of data that must be analyzed. So there's a relatively broad set of changes that occur, not just IT changes, but relationships with external physician groups and hospitals, but internal processes that must all come together well.
So Don, can you give us a couple of concrete examples as to how IT can support you in this?
Well, typically in the past, a medically justified MRI was a major source of funding for organizations. It was a revenue center that was valued. As we move forward now, it may not always be the case. So we need to give physicians, we need to give the patient the understanding of how the new schemes are going to work and how they can operate within them. Because again, what used to be something you would encourage in the past as being medically justified and appropriate now may be detrimental to the overall revenue cycle or revenue operations of that organization.
So we would be looking for example,
give the physician particularly the information in a concurrent basis so that they can understand what's happening. Because literally that's what they ask us for all the time. They want help in understanding how this is all working because it is very difficult for them to keep up with it because they're more concerned about the patient than anything else.
So we're looking at large amounts of data that needs to be scrutinized.
Your problem with large amounts of data is who's going to look at it. You know, if we move to an environment, an electronic health record, when you're with your primary care physician, they're sitting there staring at a screen instead of working with you. That's not where we want to be either. So we have to be careful in how we provide data, that it's useful data, not just data.
So what will be the contribution of ICD-10 in all this, Don?
ICD-10 is obviously exponentially more complex than ICD-9. So it's going to add a whole new layer of complexity as we move forward, trying to understand what will happen in the future. You're going to have your models built on how ICD-9 is built, and now the new payment systems will be in ICD-10. We don't know what that will do yet, so it's a whole new another layer of complexity you'll have to deal with and probably deal with on the fly.